And you get that brown thing up on here, which is horrible. With me is Dr. Bruce Katz, and we're going to talk about lip balm. And you say there's a big difference between lip balms that are on the market.
That's very true. In fact, people often neglect their lips. Lips can be problematic, particularly in the winter months. They dry out, they can get chapped, sometimes cracked, and even infected.
Infected?
If it's not taken care of properly. And there are a variety of different products out there that can really help keep the lips in great shape.
Okay, let's take a look at some of them. What do you recommend?
Well, there's basic Vaseline. It's still one of the best treatments for chapped lips, which helps prevent the lips from getting out of control and cracked and irritated.
Just plain old Vaseline, but it's kind of difficult to put on because then you have to put your finger in the jar and then you have Vaseline all over your fingers, and that's just not fun.
Well, it's actually quite nice and gives you a nice gloss also.
That's true. What about just plain old lipstick? Does that protect your lips?
Some lipsticks do, but for the most part we recommend as dermatologists to use preparations that really lubricate the lips well and keep them from getting irritated. Sometimes fragrances can make the lips even worse, or you can get an allergic reaction too. So it's good to use really good basic products.
What about SPF? We think in the wintertime we don't need it, but we do, don't we?
Exactly, and the SPF 15 or higher lip balms really help to protect the lips from sun damage when people don't realize they're actually getting damage to the lips, which can make the lips even more chapped.
Because the tissue is also very sensitive to sunlight also, am I correct? And you can get a sunburn, especially if you're skiing in the wintertime.
Exactly. If you're skiing, you should really wear a good product like Vaseline or something with a SPF 15 or higher to really protect from sun damage. People often don't realize you can get skin cancer very often just on the lower lip if you get too much sun damage to the lips too.
Okay, here's a problem. Cold sores.
Cold sores really should be treated by dermatologists, really not just limited to the lip balms, because they can be problematic.
Is there a balm that will take away the sting of a cold sore for a while that you recommend us using?
Well, there are a variety of different medicated lip balms that can take away the stinging, but you just don't want to let it get out of control. If you start getting blisters on the lips between the corners of the mouth, see a dermatologist to be sure that you get the proper treatment.
Okay, so use a medicated ointment if you have a problem with chapping. Is that what you recommend?
Exactly. Medicated one, very higher end, very nice moisturizers like this Elizabeth Arden product work very well, but chapsticks, a variety of different lip balms can do the trick just for mildly irritated, dry lips.
And is there really a difference between these products except for price?
Some of them have new medications, some have the alpha hydroxy acids, which may be helpful, but they're basically just lubricants that help stop the dryness, help moisturize, and prevent worsening of the chapping.
All right, Dr. Bruce Katz, thank you very much. Jim?
All right, Maria.